The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you got to get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
All right, folks, thanks for joining us. I am joined today by Dr. Nisha Manek. Am I pronouncing your last name right?
Perfectly.
All right, Dr. Nisha Manek. I met Nisha at a conference here in Phoenix, and we were just chatting, and she mentioned what she did, and I said, oh my God, you've got to be on my show. So Nisha, thank you for accepting my invitation, and thank you for being here.
Jack, it's good to be with you. Thank you. Really, thank you for having me. I couldn't be more excited to talk with you.
I'm really excited to hear what you've got to say. So let's just dive right into it. We try to keep this show tight and focused for our listeners. What one specific health issue do you want to address today?
Great question, because we're seeing an epidemic of diseases. We're living in America.
Yeah.
I come from Kenya. I was educated in the UK, Scotland, and I come to America. And if I look at my career, 20 years or so here, the increase in diseases is astonishing, Jack. We're looking at, I'm just going to say heart disease, cancer, asthma, diabetes, obesity, hypertension. I'm not going to say anymore. Metabolic syndrome. But what is the common denominator? What is the common denominator that underlies all of these?
Well, you're here to tell us.
Inflammation.
Inflammation.
And you know what medicine does? It's looking for smoke signals. We want to look for smoke signals with our questions, examination, and blood test to try and put out the fire. And we're doing a really poor job in looking for the smoke signals. We don't even know sometimes that the smoke signals are there, okay? So inflammation is the name of the game in medicine right now. This is why we age. This is why your skin wrinkles. This is why your bones break. This is why your heart has heart disease. This is why your immune system goes bananas. And then you have cancers happening. Inflammation. And inflammation has so many variables playing into it. But regardless, we can get underneath it. And that's what I'm so excited about telling your viewers.
Well, the question too is always what got you interested in this. But before you answer that, I think it'd be really cool to just very briefly give your medical credentials. I was reading through them and I was like, wow, this lady knows what she's talking about.
That's kind, yeah. So I was educated medical school at the University of Glasgow in Scotland. And I did internal medicine in London in a teaching hospital. Okay, and I'm a fellow of the Royal College of Physicians. And I came out to America and I was in Stanford University, which is where I did my immunology education and fellowship. That's a further advance. Okay. And from there, I jumped to the Mayo Clinic in Minnesota, which is where I did most of my academic work. And Mayo Clinic is very special. It's a very, you might say, the ivory tower of conventional care excellence, right?
Right.
So I was a part of the team there, not only doing what they call the three shields. I was very active in education, medical education of our residents, medical students, fellows. And then I did the second shield, research in what is arthritis. I'm a rheumatologist. So I take care of people with immune diseases. All right. So second shield is there's education, research, and then excellence in clinical care. So I did all three. And then I left the Mayo Clinic because I asked the simple question, there must be more than just chemical medicine to get ourselves well. And
This is
then,
why I
and
said, be on my show.
I'll tell you this, Jack, you need to listen to this because when I made that decision, a lot of people thought I'd lost my marbles. Walking out of the Mayo Clinic, are you crazy? Jack, I found my marbles. I didn't lose anything. I
All right.
think there was something really beautiful to be discovered.
I
Yeah.
know right now people are listening and people are asking the same kind of questions that are going through my mind. And is we want to hear more from this woman about this story. The problem is we can't do it in this short 20-minute focused episode. So I'm promising my listeners, Nisha Manek will be
Yeah.
involved in a long form conversation with me, either on this show or on Stay Off My Operating Table. But
Yeah.
all right, so there's the background. Let's go to question two. Why'd you get interested in inflammation?
Rheumatology is inflammation which has gone haywire. The body's repair system, inflammation is actually necessary to repair if you have an injury or a cut. It's there, and then it's self-limiting. It resolves and you heal, and that's it. But in my specialty, rheumatology, we look at inflammation, a swollen joint, a swollen wrist, skin rashes, swollen eyes. So we're looking at inflammation, which is an immune system that is dysregulated. Okay. And we look at genetics, we look at smoking, we look at alcohol, we look at all these other variables to piece it together to try and stamp out the fire. We're not even looking for smoke signals here. We got the fire and it's
Right,
raging. And we
right,
know that immune diseases, these folks are suffering, and they don't die of a swollen knee. They die of a
right.
heart attack and they die of cancers. So it's accelerated.
Mhm.
Okay.
Yeah, I
And
never
so
put
we
that
need to
together
get
before.
underneath that. Yeah, go ahead.
I never put that together. I've got a friend with severe rheumatoid arthritis, uh,
Yeah.
but I never heard it. I never put it together that they're not dying of this swollen knee. It's
No,
it's the other things that are
they're dying
that
of
are killing them.
inflammation and it's damage.
Well, I typically ask at this point, what's the biggest popular misconception about inflammation? And I would
Okay.
love you to expand on that if it's necessary. But it sounds like we've already got some
Yeah.
addressed some of it.
So, look, inflammation is huge, right? And what we think, and I attend medical conferences. I just went to two. I was speaking in Michigan. I attended another medical conference in rheumatology. And the biggest misconception, Jack, is that a drug is going to take care of us.
Yeah.
The next blockbuster, blah, blah, is going to take care of our patients. Listen, I had that viewpoint at Stanford, okay? And the reality is, there's been no blockbuster drug ever to take inflammation out in all of its aspects. None. So we have to get
So
real about this. And I'll tell you, in rheumatology, Jack, here's what we do. Let me paint you a picture every single day in my clinic. A patient comes, they have a swollen knee, they have rheumatoid arthritis or whatever. What do? I go to a guideline written by my colleagues, experts. I used to write these guidelines for goodness sake. Then we take a molecule, a drug, we prescribe. Will it work or not? It's probabilities. Might not. Then we go into a error, trial, and error, trial. We're getting a drug one after another. And this patient is in the meantime suffering inflammation. I can't tell you the amount of cost to life,
Mm.
to living well, to the financial consequences. I'm not going to even go into the side effects. We won't go there. We
Oh
already
gosh.
know that. You just look at the television commercials.
Yeah. Yeah.
Okay. So the biggest misconception is that a blockbuster drug is going to take care of you. I think it's a fallacy. We use drugs wisely, but don't depend on that all the way.
Yeah. Well, so the truth is, it ain't going to happen. All right.
It goes only a little bit of the way, but ain't going to happen all the way. It's incomplete healing.
Okay. Now, somebody is suffering from any of the symptoms of inflammation, the likely outcome if they don't take action. We're talking to
Yeah,
you listeners. You're dealing with something in your physical health that whether you're aware of it or not is very well caused by but the underlying cause is inflammation. What's the
right,
likely outcome if folks don't
right.
get it fixed?
Now, of course, I'm seeing a spectrum of inflammation that's quite severe. I told you it's a fire. You know, it's not even a smoke signal here.
Yeah.
But ordinary people, you and me, all of us have some degree of inflammation going on. Fatigue, brain fog, uh, you know, um, lack of energy and joy of life. We're aging before our time. In fact, the lifespan is shortening. We weren't living longer anymore. The last decade has shown that our younger people are living less and less and less. And so, one thing I want to ask, and this is a question every viewer here should ask themselves, given all of our medical advances and all of our drugs and all these things that we see, ask yourself a simple question. Is your health better off now than it was even a decade ago or even 15 years ago? Ask yourself the question, are we better off? We know the answer to that.
Yeah.
And I'll tell you, as a rheumatologist, we're not better off.
Wow.
Okay, we're seeing more. So ask yourself that one question. Then ask yourself the second question. If you had to take one step that you're assured 100% success rate to get you to better health, would you do it? I'm not talking about blueberries and turmeric and all that. I'm not going there. I'm talking about fundamental things about the body's healing capacity because I know the answer. And it was as surprising to me. Okay, we'll come to that.
Well,
Okay,
yeah,
but I
let's
assure
do
your
it.
viewers
We're
that
at
they
we're at the heart of the issue now. What specific action should folks take?
Okay, so I left the Mayo Clinic to find that there must be a better way to health than just more chemistry. Okay, there's got to be a more fundamental scientific law. And what is the most trusted law in science? Energy. The laws of energy are working here and now, right now. The truth is, Jack, right now, all of your body's processes of hearing me speak, of taking in the information, of my heart pumping, my lungs taking oxygen, repair is all based on the energy running. Energy is more fundamental and it makes the chemical processes run. It makes your drugs work. We are lacking the battery power to make those processes run seamlessly. No instruction manual needs to be done. And you know something, Jack? This is the most remarkable. My medical education never taught me about the subtle energy systems of the body. Who taught me that? Physics. You have to marry physics with biology. You got to do physics.
Oh
And
man,
where does the
this is such a
education
this
about
is
physics come in? Of
so much here.
course. So who reads physics journals? Nisha Manek does. Medical doctors don't. They don't have the time.
Yeah,
We're getting information overload just from medical journals.
yeah.
Nowhere does it talk about the subtle energy systems that are already in the bodies. It's already installed. And here's the biggest, let me just say, wisdom. The sun rose today, and I went out and greeted it because the sun's warmth got the energy of the earth moving. The birds came out, the bees are humming, there's a dragonfly. I got my little spa cover back on. I'm watering my plants because there's a rhythm and energy to the cycles of the sun. The biggest battery of nature and humans is the sun. But there's a sun inside of us. There's a fountain of energy already installed within us. The
Okay.
sun's rays, the sun's energy flows from the high to the low, right? The body's energy has inside of it a higher potential, like a spark plug. And when you connect to that, the energy flows from that higher source. And what happens when the energy flows? It regulates all of the body system, including your immune system, and will reduce the inflammation, turns the dial down.
So
I know this to be a fact.
are you saying just get out in the sun?
No, I'm saying, but I'm going to show you how to
Okay.
connect to your body's polarities. Shall I go into that?
Yeah, let's do that.
Okay, okay.
Let's do something take an example. Um one of the types of uh, conditions that our guests on Stay Off My Operating Table most often address is type 2 diabetes. Let's
Mm-hmm.
assume we're talking to a type 2 diabetic or
Yep.
pre-diabetic.
Okay. Yes. Good. We want to take their whole pancreas, the internal systems, to now have good insulin and insulin receptivity, which is now being impeded because there is inflammation. You may not detect it on blood tests because it's too late. We've got to get into the prevention now.
Right.
So, I'm going to tell you, my research with physics has established, and I'm going to say also, I wrote about this in Bridging Science and Spirit, my book, Bridging Science and Spirit. So I give the evidence, the scientific evidence that you have within your body systems higher energy called subtle energies. And here's the other fact. The body, we always say, oh, the body's electric. That's only part of the truth. The whole truth is the body's magnetic.
Mhm.
And like a magnet, the body has polarities on its
Sure.
surface.
Sure.
So, the first thing you wanted your pre-diabetes people to do, and everyone loves this, is to lie down. Take 20 minutes out of the day, lie down. You could be in your office, lie down. You could be in your dorm room. Oh, I got a test, or I'm tired. Lie down. Housewife, I got to do this, overwhelmed. Lie down. This is applicable to everyone, including my specialty. All right, my patients, lie down. Now, the polarities of the body. It turns out left hand behind the back of the neck, and then the right hand behind the sacrum, right there. You're connecting the body's opposite polarities. The
Is
third
this
thing,
where is this where cranial sacral uh uh therapy comes in?
I'm not familiar with craniosacral, but I wouldn't
What
be
you're
surprised at
describing to
all.
me, uh, I don't want to take us off in a different direction, but I've I've had that kind of treatment before,
Yeah.
connecting the base of the cranium with the base of the sacrum.
But make sure it's
But
and do it
it was
with me
somebody
now,
did it
Jack.
for me rather than me doing it myself. Left hand, base of the cranium, right hand, base of the sacrum.
Yep. And then
Oh my
put
gosh.
your left ankle over your right. That's it. And you're lying down, okay? Close your eyes. You don't need any fancy breathing, no fancy postures, no fancy nothing, no prescriptions, no drugs. Imagine that. Now, for some of my patients, this kind of position can be a little hard with their wrists and stiffness. So you can have like Eamon screens. They're called Eamon screens. There's a screen behind your neck and a screen behind your sacrum, and you connect them with a wire, and they're just lying there. And I'll tell you, it's magical. The first thing that, and here's what I want to say. As a doctor, I want to try the medicines I prescribe to my patients. That's a good doctor, by the
Oh
way.
yeah.
Okay. So I did do this when I was first introduced by Dr. William Tiller. He's the physicist who introduced me to these concepts, and I was blown away. The first thing I felt was, wow, I can feel the energies in my body, just like you were doing Qigong or Tai Chi or yoga. It was immediate for me. It was immediate. And I could feel little tingling in my palms. But here's the thing, within the first few minutes, my scalp relaxed and my brain became quiet. It was like a semi sleep. And when you come out of it, you're deeply refreshed. Subtle energies penetrate every nook and cranny of your body. I told you, it's the one connector from head to toe. We think in separate terms like the knee or the ankle, but the subtle energies are running throughout. Here's the other thing. Where's the immune system renewing itself? The bone marrow. The
Okay.
subtle energies penetrate right into every nook and cranny, and now you're getting new renewal cells inside and out. 20 minutes a day in this position. Try it. And if you want the even,
It's so funny here. Um, Nisha asked me at the start of the show about the visuals here, and I said, "Oh, this is not really a visual show. We just have YouTube so people can listen." But if you're watching, um, you know what she's doing. If you're not watching, I'm going to remind you: left hand laying down on your back, left palm at the base of the cranium,
yeah,
right palm at the base of the sacrum, left ankle crossed over right ankle, lay down, just laying down for 20 minutes. That is
that's
so
it.
cool.
That
This
is very,
reminds me, this reminds me of Tibetan pulsation therapy, which my wife actually practices. The single most powerful healing modality I've ever run into. Um, and I know I know it's similar to what you're talking about. It's energy flows. I can't wait to go do this. I wish I could go do it immediately, but
yes, yes. And you know what? For a lot of people, the resistance is, we've never done it like this. This can't possibly do anything. I can tell you, okay, let me just say, as a physician, and I've tried this my own medicine, okay, if I can call it medicine. And I wrote a book, Physics of Consciousness, Physics and Consciousness. These two things would make anybody have a headache, okay?
yeah,
just tackling these subjects. The emens, this circuit, this biocircuit, if you can call it that, biofield, saved this book. I could do research in the morning, write my manuscript. By the afternoon, I would just lie down 20 minutes. I would feel like I'm falling asleep, but I'm hyper alert. I would come out of it rest of the day into the evening. That book was done in a year. Okay. I can vouch for this. And I'll tell you another thing. I'll give you two case reports. The first one is she wrote to me, and I'm sort of under the radar. I'm not a famous anybody. I
sure.
don't care. Truth is not a popularity contest, Jack. Okay. And I'm about aesthetic and clean information here that I know will never harm anyone. It's
Yes.
no cost. Okay. But this was a professor of dance, contemporary dance, University of Calgary in Canada. She read Bridging Science and Spirit, was so moved with this biocircuit because I talk about it. I said, look, you've got all the physics. Here's what you need to do about energy, because that's going to move you towards health. It's already installed. It's your divine gift. It's a gift. It's God. Anyway, so she writes to me, Professor Davida Monk. She got through to me from an unused Facebook page. She writes and contacts me and said, oh my God, what you wrote about this? I get it. And she started to teach her students, and her dance ensemble in Canada about this biocircuit. She vouches for it. She says, you know something, Dr. Manek? Everybody should be taught this. School children should be taught this. College students should be taught this because it's a gift. And they will have so much energy and they can do whatever they want. They can be creative. They can create new information. Their school becomes easier. Children's brains become quieter. ADHD, all this is treatable. Why are we giving them chemicals all the time? Davida is a convert. Davida Monk from Calgary. Second case. This is a young woman in the UK. She has rheumatoid arthritis for many years. She has deformities. She's on drugs, trial and error, trial and error. I mean, end of her tether. She found me through a podcast like yours. That's all she did was the Eamon screen. She went to Barbados recently, a month ago, and she took this biocircuit. She can't do the position, so she bought the copper screens and she does it. She said, you know what? I don't have to look for a socket and plug into anything and $1,000 equipment. I took my screen and Dr. Manek, it was the best holiday. She comes 20 minutes a day. She's able to be energized, no pain, does her thing, came back from Barbados, totally healthy. Look, this does not require any rocket science, Jack. It's simple. Your body has polarities. Once you have this first knowledge, run with it. Run with it. I'm insisting on it. If I can tell your viewers, take your 30 days, try it out.
Try it out.
You just need to lie down. Who doesn't like doing that?
Lie down for 20 minutes and connect these positively and negatively charged poles in your body. I want to dive deeper. I promise we are going to have a much longer conversation, but I've also promised my listeners that we keep this tight. Um, let's talk about your practice. What's the most common complaint you hear?
Okay, if I do subtle energies, no complaints. Zero. Had any. It's true. It's like Davida Monk saying, and look, dancers are athletes.
Oh yeah.
They know their body. In fact, they're the athletes in the world today because they have to have a complete knowledge of their subtle energy systems. And if you have a patient like mine who has chronic rheumatoid and saying, wow, I feel so wonderful when I get out of this nap. It's not even a nap. It's just, I like lying there. There's no complaints. I haven't had any. What can I say? So the pain reduces naturally. And you know what? I would say, and I'm going to submit that when patients are taking, or your viewers are taking medicines, hypertension, all of these drugs, then when they do this, they can monitor them, self-monitor their progress, and work with their doctors and say, "Hey, can we look at the doses again? Maybe I don't need so much." Work with your physicians. And here's what I'm going to challenge them: become your own chief medical officer.
Yes,
Yes.
absolutely. If there's any overriding theme of the work that we're doing on this show and on Stay Off My Operating Table, that's it. Take responsibility for your own health.
Yeah.
All right, well, let's talk about is there like a just one particular compliment that stands out above all the others that you've gotten as you've practiced this?
Yeah. I do mostly telemedicine, and this really touched me because I had a patient in Wyoming, and she just looked me in the eye. Alice looks me in the eye and said, I've never felt better in my life. And she has had RA forever. And
This
she
is a
goes,
rheumatoid arthritis patient.
yes, I've never
Wow.
felt better in my life.
Wow.
Look, look, they're in rural Wyoming. Okay, there's no resources. I come on camera and I teach them just simple things like this, that look, you can do it. because they can't afford blueberries and turmeric and every other supplement on the planet Earth. And we're going into energy. Can't fail you. You're working with the most powerful laws of nature. If you wanted to brew a cup of tea and go to the moon, you better know your thermodynamics and laws of energy. It's the
Yeah,
same. I've never felt better in my life, doctor. I want to say thank you.
that's pretty
And I
good.
say, Alice, it's okay.
That is
She's
pretty
working
good.
with her knowledge, it's just rediscovering. And it's like saying, let me take off my shoes and connect with Earth because the Earth is magnetic.
Yeah.
That's the same thing. I'm just giving you a higher order of information.
Oh gosh, everybody wants more. All right, we're going to finish this up. If you could deliver a single message about health and you had no more than 8 words to deliver that message in, what would that message be?
8 words, Jack. I'll do it in 6.
Excellent.
Connect with your body's divine gift. Connect with your body's divine gift. It's there for you. Those are the 6 words. You don't need anything else. If you do just this, connect, lie down, be thankful, heal yourself.
That's a good one. Our guest has been Dr. Nisha Manek. You can learn more about her work at nishamanekmd.com. That's Manek. This information will, of course, be available in the show notes. Nisha, anything else you'd like to say before we say goodbye?
Thank you. I hope your listeners and viewers take this really to heart. I know what I stake my reputation. I know what this is. This is the truth. On Nisha Manek MD, when they come to the website, there's a newsletter about subtle energies, just a couple of pages with the figures so they can look at it, refresh, put it up, send it out. Send this out to your neighbors and everybody you love. Show a bit of love and tell them how to heal themselves. And if they want resources of the copper screens I was talking about, there's 2 resources I've tried myself, which I do every day. I do this every day. So they're there. The links are there and they can get going. That's it.
Very good. Thanks for joining us, folks. This has been the Predictive Health Clinic. We'll talk to you next time.
Thank you.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.